All right. Well, thank you all for joining us this afternoon for creating meaningful multi-channel communications, where we're going to explore Clarity's capabilities to meet your unique correspondence needs. My name is Heidi Worth. I'm the Director of Strategic Partnerships. I have 30 years plus, can't even believe I'm saying that, healthcare experience, focused last in member engagement, partnership strategy, building ecosystems, and managing those partner relationships.
Yep, and thanks for joining. For those I've spoken to on other webinars in the past, my name is Drew Corbett. I lead our engagement and design work here at Clarity. So all of the things that we've been doing over the past few years to recognize that we can really heighten the discipline of member correspondence within health plans and make all these things engagement tools. I've got a long history in doing that, both from the industry side, the consulting side, but kind of a career spent in healthcare strategy. So we'll be speaking through that lens today.
Thanks, Drew. So we'll start with a Clarity overview. Clarity was founded in 2007. We are located in Madison, Connecticut. We are a healthcare engagement platform, and we're going to explore more what that means. We have over 100 healthcare clients, and as you can see from the logos, we work with both national plans as well as regional plans, and PBMs, TPAs, and we cover about half the insured lives of the United States. Here's a snapshot of our markets. This is a current breakdown. If you look at the core market, that's our health plan market, and we cover all lines of business. You'll see our overall client distribution, where we have core markets, BPOs, TPAs, dental plans, and PBMs. So let's start with the Clarity Engage platform. Our platform is built on a foundation of strong security, and we're going to talk a little bit more about that in a few slides. We are data agnostic, which makes us very flexible. We can ingest just about any type of data. Our outputs, multi-channel modes of communication, so email, text, mail, print, etc., as well as focused on core and complementary communications, where we can drive next best action and allow for partner integration. We are healthcare only, so only work with healthcare companies. And now the numbers, we touch more than 110 members per year. We process about 220 million records annually. We have over 10,000 users that are leveraging the platform. We receive about 210 million API calls, and we average about 15% engagement on our next best actions. So let's dive into what we mean when we say core and complementary communications. So core communications have been our bread and butter, and are basically those that are required: member guides, welcome letters, ID cards, EOBs, EOPs, ANOCs, summary of benefit coverage, 1095s, and other correspondence, letters, invoices, and notices. Our complementary communications are where we really expand the portfolio of what we can do for you. We can do all kinds of member service surveys, from SDOH surveys, health risk assessments, health outcomes surveys, NPS scoring, anything that you would need. We can accommodate. We can do condition management promotion, and this is where a partner integration really comes into play. So we can add partners into communications, and we can do communication for partners as well. We promote virtual care, and we can do the same thing. We can promote it within the health plan communications, but we can also do communications for any of those types of companies. And lastly, preventive care, where we can send out reminders and education for things like annual visits, mammograms, colorectal screenings, flu shots, and other vaccines. So the takeaway on this is that for those of you that send tens of thousands of communications every year, we can be your one-stop shop. So now that we've explored the what, let's talk about the how. So our bread and butter started with the traditional mail. Letters, booklets, postcards, and more. It's tried and true, and we have a near 100% contact rate, and that's not going away. we'll still have mail, but we're expanding our portfolio really broadly to cover the digital component. So email, text, which allows for faster delivery. It's more cost effective. It's interactive, and we can do A/B testing, which allows us to really understand what types of communications work best for what types of people, and it's data rich. So now into security. With the environment today, we know that security is of utmost importance. We operate on AWS, and we use virtual private cloud, and we follow the NIST, or National Institute of Standards Technology framework. We are very proactive in our safeguards. All of our in-transit and stored data is encrypted with the highest security algorithms. Access to data is limited to those people who need it, so authorized personnel. And we utilize identity access management and multi-factor authentication to access data. We also have robust processes, change and risk management processes and protocols, auditing, credentials, access, and vendors. And we have routine assessments. We are SOC 2 Type 2, HIPAA, and HITRUST certified. We really take a security first approach. We have a strict set of policies to protect personal health information. So we redact all PHI in our test, QA, and UAT environments. We use SFTP for all PHI data, and we don't accept email or test files that contain PHI data or more than 2 fields of identifying participant data. Now let's really get into the multi-channel component. One of our advantages is that we have our own state-of-the-art production facility. Our 78,000 square foot facility has very high standards in which we can turn packages around in 2 to 3 days with more than 99% accuracy in terms of delivering. We also have disaster recovery redundancy processes in place, as well as equipment. So multiple generators, multiple internet connections, multiple production lines, and fiber optic connectivity. We have full service support. So we are dedicated, as I mentioned earlier, to healthcare communications only. And we provide full support for those communications, including using color technology to increase engagement. We have built-in quality control. It's actually really cool. We have cameras that take pictures of barcodes as we're going through the production process, which allows us to really configure packages correctly. And we're proficient in matching recovery, reporting, and status, etc. And as I mentioned earlier about the platform is HITRUST SOC 2 Type 2. Our facility is also HITRUST SOC 2 Type 2 and OSHA certified. So we really are a one-stop shop, and it's state of the art. So that covered our print, and now we'll talk a little bit about digital. So digital solutions deliver greater value, and we all know everybody wants to go digital. Print won't go away, but we know that everybody wants to go digital. Just the cost savings alone on paper postage and overall print production, faster delivery, minutes rather than days, data rich. We can learn a lot about engagement through A/B testing, which is available through digital channels. And we also can build our member 360 profile. It's the future, and it's anywhere, anytime. You can access at a touch of a button. And of course, it's environmentally friendly, reducing the carbon footprint and eliminating paper. And we're taking it beyond just email and text. We have a profile portal that can capture information about your members, anything you would want to know, contact information, preferences, and even how they respond to different types of communication. That gives us a member 360 view, which is a comprehensive view of member information and engagement data, which means the more information, the better, more targeted outreach, and therefore the higher level of engagement. Our digital features include things like configurability, which basically means that it's very flexible, and along with the data type being flexible, the format of the communication and the triggers of the outreach are also flexible. We have self-service capability. I think that speaks for itself. We have over 10,000 users that are on the platform today using that self-service capability. We can automate it, so outreach can be triggered by an event or within a specific time frame. We can measure what actions are being taken in those periods. It's compliant again with the requirements of digital communications, 508C, TCPA, and FCC regulations. One of the unique things we have is we have an off-the-shelf experience where you can leverage ready-to-implement content that's backed by research, behavioral science, and best practices. We have a streamlined setup. You can configure a plan and set it up and forget about it and only monitor as you need. We can also track, analyze, and improve. So with personalized URLs or QR codes, the communications become trackable, which again helps in A/B testing opportunities to learn what performs best with members or a different type of member. I spoke earlier about the member profile portal, which really drives capturing member contact information, engagement, etc. And we have multi-language capability as well. Our newest feature is the digital wallet. It really improves the member experience, increasing member adoption and satisfaction, and it's convenient. It makes it easier to access your digital ID card rather than having to go to the web every time you need it. It's a modernized experience. It'll advance your brand forward, offering more modern features. It's an anywhere, anytime access. So having all of your cards in one place, without the need for Wi-Fi or cellular service. It's an extension of your brand. It's another way members can engage with your brand. And it's a one-stop shop. So all of their cards can be in the same place in one location rather than, in another digital location where they have to go and find it, or it also avoids print because oftentimes, though they go and capture it digitally, they often print it. And so it becomes a very environmentally friendly option. So now I'm going to turn it over to Drew to talk more about our approach to engagement.
Yeah, thanks very much, Heidi. So, as I'm thinking through everything you just presented, and I'm thinking about the sort of bedrock tenets of being a healthcare company, we have to be secure. We all know that we're sort of operating in an environment of immediately following very public data breaches, and we know that that's something that we all have to be mindful of. So some of these really core tenets and features, they have to be there. And then when we start to look at the ability that Clarity has to just reach people, that's when we start to get sort of more strategically interesting in how can we apply some of these ingredients to meet our market needs. So whether you're listening and you're coming from in-house at a health plan and trying to engage more members in, be that a mobile app download, if that's a portal registration, if you've got an in-house program that you're trying to engage members in, or if you're coming from a digital health technology and you're saying, I'm actually contracting with these health plans and we're trying to get as many of their members who are relevant onto our platform as possible. What I think that all sort of amounts to is Clarity has reach. And then we have a platform that allows a sophistication within that reach. And when we think about what we're able to do, we look at a huge population of people and we start to distill down to, what segments do they fall into? And this might be our lines of business. This might be particular employers within the commercial line of business. And for those different segments, are there ways that we can personalize to an individual level, and then ways that we can reach via multiple modalities? So we know we're going to have this immense blanket of reach with our print modality because we have such a high fidelity of addresses in the way that we issue our correspondence. But additionally, like Heidi had mentioned, layering in the ability to meet people where they are with SMS, with email, that multi-channel outreach has to become a really bedrock piece of what we do in engagement as well. And all this amounts to, like, we are in the business of trying to connect people with benefits. And the more that we can have that right message to a person that's going to be resonant, that reaches them with a relevant benefit, that's where we're going to see that that engagement level bump up just a little bit. What we really preach through Clarity is there are any number of pieces of correspondence that have to go out in a given year, regardless of the modality. If we're exercising best engagement practices in that steady hum of discussion with our members, the next year we're going to be 1% better. The next year we're going to be 1 or 2% better, and so on and so on. Integrating this as a core practice into your correspondence is what over time, over that 3-5 year period, enables you to really separate from competition, to have those better CAP surveys, to have that better engagement with your membership. So this is how we're sort of applying all of these ingredients that we've got under the umbrella of Clarity. And as we go to that next slide here, we're having more and more discussions on, okay, that's great. We've got the ability to engage, but what really matters is what are we engaging people in? And this is where it starts to become a really interesting strategy discussion meets the practice of correspondence. If we know as, say, a health plan that we're focused on driving people into a digital relationship with us by way of a portal registration, if we know that we have pay-for-performance measures where there are wide open gaps across huge swaths of our population, I mean, really digging into some of those star measures with this and our next one, condition management, if we know that that's a place that if we ran into that member on the street who is non-compliant, we tap them on the shoulder and we'd say, hey, just get involved in this one program. It's going to make you healthier and it's going to be a heck of a lot easier. That's effectively what we're able to do with these next best actions. And as people go through this chronology, and as you have this discussion within a health plan to say, what is most important to us, we kind of arrive at this idea that we don't just want to have transactional discussions with members. We actually want to know where they're at and know that through this journey of their benefits utilization, they can be at a much better place. And how do we start to wind them through that journey in the appropriate way? So it is the targeting and the segmenting, it's the personalization, it's reaching them how they want to be reached, all of these things we discussed. But when we put a broader wrapper around this and we move away from that idea that we're just doing these single calls to get a member involved in a single action, at Clarity, we call that a more sophisticated program design. We're trying to understand the 3, 4, 5 actions that a member could take to really be more fully and richly utilizing those benefits and wrap those into one sort of rule set such that whenever an organization like Clarity is reaching out to that member, they are being advanced commensurate with that rule set. If it's taken 4, 5, 6 pings to get someone to just register for that portal, we're going to stay on that until we establish that digital relationship, maybe trying different types of messaging. But as soon as we've got a member there, we already know in advance, okay, what are we trying to move them to next? Maybe mail order pharmacy is the next right step for that person. That program design is going to tell us that hereafter, all correspondents, regardless of modality, are going to press on that next action that we want to get that member engaged with. So that's what we look like as program designs. And as we look at this through just a slightly different lens, I mean, this is one of the ways that we're facilitating really interesting discussions with our health plan clients is to say, look, you've got a population, and from your clinical quality department, from your STARS measures team, from your marketing team, I mean, this could really come from myriad places within the organization, but there is a priority of what we want to get these members involved in. To integrate that into the rules engine that lies beneath everything that Clarity does is really, really easy for us and is a really simple sort of architecture to administer. So that again, and Heidi used the phrase earlier, this becomes set it and forget it. If we know that these are the rules in terms of what we want people to engage with, we can establish these in our system that's reaching out to those hundreds of millions of people, and just make sure that as the next piece of correspondence comes out of our print facility or is going to be delivered digitally, that it's encouraging the right action here. So now let's think about that from, if we go back just for 1 second, if we think about that from the point solution perspective, or from the digital health company perspective, you all are the ones that actually facilitate the programs that lie within these calls to action. And so if I happen to be leading a diabetes reversal or diabetes prevention program, and I'm in a company that does that and only that, and I serve the health plan market, this is a great opportunity to make sure that the call to action to your program and the front door for your program for that particular client is represented on these things. So we want to do more than just use words to say, hey, go find your diabetes prevention program. We want it to be sophisticated enough that we're just putting that QR code right in front of that member and saying, if this is a recent EOB for a recent visit to a certain type of clinician, then we want to make sure that the resource that allows you to extend the care of that clinician, something that's already being paid for by the health plan, is right there for you to engage with. So sort of think about these as not only mapping the calls to action, but also a way to enrich and engage all of those programs that a health plan has sort of contracted with to close gaps within these disciplines. We can jump on from there. So, I mean, what do I think about as like, what are we really saying here net? There are partners that are aligned to the entire membership of sort of commercial Medicare, Medicaid members throughout the country. This plumbing exists, and Clarity is really sort of the architecture of that entire plumbing. And what we're able to do is configure so that we're driving even more value through all of that system that's set up to reach so many members on a daily, weekly, annual basis. And that's really not been used to drive engagement as much as just to check the box on correspondence. So there is a lot more value that we can get out of very, very little effort by leveraging the correspondence discipline to ensure that it is also additional wind in the sails of the engagement work that we know you're all working on. Heidi, I don't know if you'd add or say that any differently, or just any comments on some of this content.
Yeah, no, I would just add that, you know, the one-stop shop option and our customer service. We've got a 55 plus NPS score, which means people are liking what they're using, and you know that speaks volumes.